Hi there, we Group 1 would like to present PEG-related doxorubicin product forming reduction sensitive mice cells with a high drug loading and improved anti-cancer therapy. The group members for our Group 1 is me, Shankar Naidu, Tan Zin Yan, Abdullah Sharif, Chia Yang Cheng, Eng Xiaoming, Lim En Ting, Nor Afrina Afwa, Jessie Lee, Farah Liana, Zafira, and Yumina Higaki.
Okay, this is the processing method for the synthesis of PEG disulfide dogs. So first step is synthesis of PEG disulfide COOH. So polyethylene glycomethyl ether PEGOH is reacted with 3,3-dithiopropionic acid catalyzed by EDCI and DMAP in dry THF under nitrogen in room temperature for 24 hours. Product with 78.1% yield. Second step is conjugation of DOX. DOX is conjugated to PEG disulfide COOH using PEA in DMF under nitrogen at room temperature. So final product 48.4% yield.
Figure 1 shows the synthetic scheme of the PG disulfide DOX polymer and micelle with reduction sensitive behavior for intracellular drug release. The PEG disulfide DOX conjugate is amphiphilic, meaning it has both water-loving and water-repelling parts. This allows it to self-assemble into micelles into waters throughout the solvent displacement method. This process starts by dissolving the polymer in DMF, then adding deionized water with dropwise, which causes the polymer to form micelles. After stirring, dialysis removes the organic solvent, resulting in stable micelles. These micelles were characterized using TEM and DLS, which conforms their size, shape, uniformity, which is a key factor for effective drug delivery. To enhance the loading, free DOX HCl was added alongside the polymer before water addition. This enabled the micelles to carry both chemically bound DOX and physically trapped DOX, offering a dual release system. Finally, dialysis removed any free drugs, leaving us with efficient DOX-loaded micelles optimized for tumor-targeted therapy. One major strategy is the use of disulfide linkers, which responds to reducing environments, especially the high glutathione levels in tumor cells. Inside these cells, the disulfide bond breaks, leading to micelle destabilization and targeted DOC release. This is simulated in the lab using DTT, which mimics the tumor-reducing conditions. And this mechanism is very important because it prevents premature drug release, reduces side effects, and also ensures site-specific delivery. Next is the dual loading strategy, which is a combination of docs and allows program release with some drugs released early and the rest is over time. It has prolonged the therapeutic effects and boosts efficacy, especially in treating solid tumors. Lastly, pegylation adds polyethylene glycols in chains to the micelles. This improves biocompatibility, prolongs circulation, and enhances tumor targeting via either EPR effect, also while invading the immune detection.
Good day everyone, my name is Yan Ching. Today I'm going to talk about the synthesis of the polyethylene glycol disulfate doxorubicin product. It's actually combined PEG solubility and stealth properties with disulfate bond redox responsiveness and DOX anti-cancer effect. This smart design ensures the formation of soluble stable micelle that release DOX only in tumor microenvironment, improving efficacy and minimize the side effect. The rationale for polymer drug conjugation is to overcome premature burst release, which is a major limitation of conventional DOX formulation. It also enhances micelle stability and stimuli responsiveness for disulfate bonds. The drug also designed for dual drug loading strategy, where the chemical conjugation of DOX to PEG while disulfate linker for controlled redox sensitive release. The drug also designed for high and fixed drug loading and also provide a versatile platform where the drug can also be encapsulated other hydrophobic drug for combination therapy. With all this design, we can control drug release profile. During physiological condition, there is a negligible DOX release showing a good systemic stability and a reductive intracellular condition where a rapid DOX release about 86.9% in 24 hours triggered by disulfide bond cleavage. Last but not least, the design also enhanced the collateral stability, which is maintained in phosphate buffer saline for over 48 hours. That's all for me. Thank you.
Next, I want to continue with the dosage form, which is PEG-related myself. This is a nanoparticle-based injectable formulation comprised of covalently conjugated DOX via disulfide bonds. This form self-assembles spherical nanoparticles and is able to enhance DOX solubility. Moving on to targeting an intracellular mechanism, the micelle size being less than 200 nanometers allows accumulation in tumor tissue via the EPR effects. Micelles are internalized by endocytosis, and DOX is then released into the cytosol and nucleus. This results in site-specific intracellular action. Lastly, improved therapeutic efficacy. This formulation reduces systemic toxicity and enhances the therapeutic index. The combination of EPR-based targeting and stimulant-responsive release allows for an early tumor killing, also prolong the treatment via sustained release. Overall, it achieved lower toxicity at high doses compared to free dogs due to controlled intracellular release timing.
Next, I'll be presenting the technology involved in the formulation. First is reduction-sensitive micelle system. These micelles are designed to respond to cancer cells with abundance of glutathione, as they have disulfide bonds which stay stable in the bloodstream but cleave in presence of glutathione. This causes release of doxorubicin directly in cancer cells, minimizing harm to healthy cells. Next is PEGylation. Polyethylene glycol is chemically attached to the program to make it more water soluble and dissolve better, as doxorubicin is a poorly soluble drug. This also helps micelles to avoid removal by immune system by acting as a stealth coating, and this also increases circulation time. That's all from me. Thank you.
Hello, I'm Yumina Higaki. Let me briefly introduce the technology behind this formulation. The micelle forming molecule is a prodrug, an inactive form of doxorubicin linked by a disulfide bond. It stays stable in blood and releases active doxorubicin inside cancer cells where it's needed thanks to glutathione. This improves drug specificity and reduces side effects. The micelles also enable dual drug release. Doxorubicin is released by breaking disulfide bonds inside cells, and free doxorubicin trapped in the micelle core is released early as the micelle destabilizes. This smart design allows controlled and targeted drug delivery. Thank you.
Hello, my name is Ling Ting. I'll be sharing the technology involved in the formulation, which is the smart micellar formulation. First, it has a high drug loading capacity, unlike traditional micelle, which require additional carrier or excipient. This system forms micelle directly from drug conjugated molecule. This means significantly higher drug content with minimal use of excipient, which help reduce toxicity and improve the overall safety profile. As a result, effective treatment can be achieved even at lower doses, leading to fewer side effects for patients. There are self-assembly nanoparticles made from amphiphilic prodrug molecule that spontaneously form micelle of about 100 nanometer in size when placed in water. This size is ideal for passive tumor targeting through what is called the enhanced permeability and retention or EPR effect. That means the micelles can selectively accumulate in tumor tissue, improving the therapeutic outcome. Because of their uniform size, the micelle also show predictable pharmacokinetic, which make it easier to anticipate how the drug behaves in the body. To summarize, the key advantages of this smart formulation including high stability in circulation, controlled drug release at the target site, and the potential for combination therapy with other nano carriers. This is all for me. Thank you.
Now we'll move to the performance and evaluation of PEG disulfide drug formulation. Firstly, the product exhibited a high drug loading content of 37.1% by weight, which is higher than most reported drugs prodrugs. Next, the self-assembled micelles form spherical particles with good uniformity and stability. In addition, it exhibits reduction-sensitive drug release, where the micelles remain stable in physiological PDS, which is pH 7.4 for over 48 hours, minimizing premature drug release. Besides, in 10 millimolar DTP, which is a reducing agent stimulating the intracellular environment, they showed rapid degradation and drug release, reaching 86.9% release at 24 hours. This slow behavior confirms that the micelles are reduction sensitive and can selectively release the drug within tumor cells due to higher intracellular glutathione levels.
Now, let's proceed about the performance and evaluation of a PEG disulfide DOX formulation, which focusing on its cellular uptake, cytotoxicity, and potential incumbent therapy. Firstly, enhanced cellular uptake was observed. Using MCF7 cells and confocal microscopy, red fluorescence appeared in both the cytoplasm and nucleus within 2 hours, showing effective internalization and drug release. Next, the micelles showed similar or better cytotoxic effects than free DOX at low doses. At higher concentration, the reduced toxicity was noted, likely due to the controlled drug release. These results were confirmed through CCK8 assays. Lastly, the formulation showed promise for combination therapy. It displayed a two-phase release, an initial burst of free DOX followed by sustained release of the conjugated form, offering extended therapeutic action over time.
Doxorubicin or DOX is a strong chemotherapy drug used to treat many types of cancer like leukemia, breast cancer, and lung cancer. However, it has some big problems. It doesn't dissolve well in water. It gets removed from the body too quickly, and it spreads to healthy parts of the body, especially the heart, and causes serious side effects. Also, many cancer patients become resistant to DOX, which make the treatment less effective. To solve these problems, scientists have created a new way to deliver the drug using something called pegylated micelles. These are tiny particles that carry the drug safely through the body. They help the DOX stay in the blood longer, go directly to the tumor, and only release the drug inside the cancer cells. These make the treatment work better and reduce harm to healthy organs.
Next, I will explain the importance of the pH-related doxorubicin drug micellar formulation. Firstly, this formulation improves solubility, stability, and circulation time in the body. pH-relation increases the hydrophilicity and reduces immune recognition, allowing the drug to stay longer in the bloodstream. Next, it provides a more controlled targeted release, reducing the exposure to healthy tissue and minimizing the side effect. Third, it allows high drug loading and a better stability, ensuring the more doxorubicin is delivered and less premature leakage. And lastly, it reduces toxicity and enhances efficacy by enabling the site-specific release and lowering the damage to non-cancerous cells.